over here. It's a privilege for me as well as a pleasure to have this session with everybody here who have taken their time out from the busy schedule to be present to hear me regarding the recent advances in type 2 diabetes management. Now you are getting a lot of patients in your chamber regarding diabetic subjects, and a lot of them come with a lot of complications and comorbidities. And now at present we have got very good therapeutic regimen with us. We can all exercise our therapeutic options for our patients for their betterment. And earlier we had just a few drugs, but now we have a lot of drugs with us, and in combination they can do the needful for our diabetic subjects. And we all know the diabetic subjects, they have all the necessary comorbidities with them. They come with renal dysfunction, they come with heart failure, they come with coronary heart disease, then they come with kidney dysfunction, neuropathy and what not, heart failure, fatty liver disease and so on and so forth, all related to diabetes. This glycemia for that matter and dyslipidemia for that matter. So these are the various comorbidities and complications relating to diabetes in terms of micro and macrovascular complications. So today, as you can see, the title of today's talk, it's type 2 diabetes management and role of combination therapy. Earlier we had just a few medications with us. For instance, we are very familiar with the use of metformin, we are very familiar with the use of sulfonylureas, pioglitazones and so on and so forth. Today, we are having DPP-4 inhibitors. These are incretin based molecules. Now I'll come to it, what is incretin based and how does it help our diabetic subjects. I'll be discussing all this with everybody, and hopefully I would like to have a very interactive session with everyone. So these are all incretin based therapies. Of latest addition is SGLT2 inhibitors. SGLT2 inhibitors has a multiple role to play, and combination with SGLT2 inhibitors and DPP-4 inhibitors plays a marvel in controlling the various diabetes related complications as well as glycemic control. Now let us look at the slides. Diabetes, obviously here you can see that it is a global emergency, particularly India. By the year 2045, India will be the diabetes capital of the world. So lots and lots of patients will be scaffolding in your chamber with diabetes, hypertension, cardiovascular disease and other emergencies, medical emergencies. Okay, so this is definitely a global emergency, and India, every 5th Indian person will be a diabetic subject anyhow. So this is about how diabetes is considered. It starts with insulin secretory defects and it also with insulin resistance. Now we Indian diabetics, we are different from our Western counterparts. In Western, our European diabetic is different from an Indian diabetic. That is one major thing. How phenotypically we are different. Because you will see Indian diabetics, they are of normal body weight. Unlike the European diabetic or the Western diabetic, he or she is an obese individual. Obese individual. But where we are obese? We are obese because until and unless there is development of insulin resistance, followed by or preceded by insulin secretory defect, that is enough insulin is not being produced by the beta cells of the pancreas. So we are metabolically obese. You see a big tummy around. So that is where visceral adiposity, this culminates in the development of insulin resistance, and so we are diabetic at normal body weight. We are lean diabetics, lean obese. What kind of obesity we are having? Truncal obesity. They come with a huge belly. Okay, we develop a huge belly because not only we are genetically predisposed, but also phenotypically we are predisposed. The reason being our meal pattern, lot of carbohydrate intake. We are eating a lot of rice. Okay, and rotis also, it has similar glycemic index. Eating 2 rotis and a cup of rice is equal in terms of glycemic surge. It's not that by eating roti we are cut downing on our glycemic control. It's not so, because both the cereals have the same kind of glycemic index. So that we have to keep in mind. Okay, so that is why Indians, we are different from our Western counterparts in terms of a phenotypic difference. So that is the reason why our treatment protocol will differ from the protocol what we exercise for our Western diabetic subjects. So this is the burden for the future. As you can see, by 2045, India will overtake China in terms of being the diabetes capital of the world. And this is definitely a very interesting slide. As you can see, this is the pathways of type 2 diabetes development, which is commonly observed among the Indian population. So today our focus will be mainly on the Indian subjects and how to overcome and how to combat such diabetes related complications that it arises. You can all see that there is impaired fasting glucose and impaired glucose tolerance. That is pre-diabetic stage. This is the pre-diabetic stage that